Hello, I'm Dr. Madalena Giacomazzi. My pronouns are they, them, and I'm very excited to present to you It's a Journey. It's a Journey is a graphic medicine book about endometriosis among trans and gender diverse people. It's built on 3 building blocks. There are 3 things you're gonna find in this book. First thing is the story of a fictional character called Cold, and you're gonna follow them from the day they're born and assigned female at birth until their late 30s when they start their own family. In this way, you can appreciate what life with endometriosis looks like for a trans person throughout different life stages. The second thing you're gonna find in this book are medical informations about, for instance, how to diagnose and treat endometriosis, and these are fully based on research that I conducted during my PhD. The third and the most exciting part of the book, if you ask me, are direct quotes from interviews that we conducted in a qualitative study with trans people with endometriosis, and I'm gonna read you my favorite one. As far as my gender goes, I didn't realize how trapped I felt in my gender until I no longer menstruated, and that sense of freedom was incredible.
Hello everyone, my name's Laura Godfrey-Isaacs. I'm a midwife and I've created this book, Pregnancy and Birth, a Graphic Guide, in collaboration with Lily Williams, cartoonist.
We had a lovely review on the Graphic Medicine website, so thank you to Dr. Laboni Das, and thank you to Graphic Medicine for shortlisting us for this award.
The book explores the journey of pregnancy, birth, and new parenting, framing the historical, social, and psychological landscape.
Busting taboos around people's choices and the representation of birth and parenting.
Empowering people to navigate their way through maternity services, acknowledging the huge shifts, changes, and challenges along the way.
Clear, evidence-based information communicated in a friendly, non-judgmental, and concise way.
Addressing stigma such as baby loss, infertility, and special care babies.
Infant feeding, the politics, barriers, and multiple forms of support.
Parenting priorities such as sleep, crying, baby skin, and baby wearing.
And here's a lovely quote from Leah Hazard: a fantastic new resource with a decidedly inclusive, rights-based approach.
We're very grateful for all the support that we've had from the book, such as Laura Krull, who said, "This book is truly brilliant, informative, inclusive, accessible, and full of personality."
And here's where you can scan to buy the book. And thank you very, very much.
Thank you, Graphic Medicine.
Hi everyone, I'm Dr. Ebony Toussaint, the writer and creator for Crash Cart. Crash Cart is my webcomic series you can read freely on Webtoons or Global Comics. We released the first episode in October of 2025. We do have new episodes coming the last Wednesday of each month, beginning this month, July 2026. Thank you all for reading and enjoying my work. I am proud to be nominated as an outstanding health-related comic project in graphic medicine amongst my colleagues and my peers who do this work as well, perhaps not in emergency room settings, but I did want to highlight the role that emergency nurses play and our training and certifications, especially in advanced cardiac life support or ACLS. I'm hoping to also shine light on the different cases that we see and manage regularly. So the next episode is going to be on diabetes. We have sickle cell anemia coming out. And again, thank you all for reading and tuning in.
Hello, GMIC 2026. My name is Dr. Ryan Montoya. I am a family medicine physician and a comic book artist. And today I'm going to read a section from my story about opioid addiction called Precipitated Withdrawal. How does this happen? Let's take a look at Mr. Shelby Custer, aka the Wizinator. A home repairman by trade, Mr. Custer fell off a ladder 2 years ago and injured his back during an unusual spackling accident. Shelby most likely had inflamed, bulging discs in between his vertebral spines and falling made them swell and cause extreme pain. Ibuprofen doesn't help, so he tries to see his primary care physician, but his cheap medical insurance won't get him an appointment with anyone for 3 months. So he visits the ER. No compression fracture on x-ray. Here are 10 tabs of Vicodin. See your primary care doctor soon, he's told. But he still can't. The Vicodin runs out quickly. The tablets block the pain, but the time in between his doses gets shorter and shorter. His friend has a Percocet from a previous surgery to hold Mr. Custer over. Shelby likes the Percocet because it works better than the Vicodin. He finishes the Percocet and tries to go back to the same ER for more medication, but he's blacklisted for pain med-seeking behavior. He needs to go to a different ER to find his meds. Mr. Custer gets his Percocet, but now he needs more pills to reduce the same amount of pain. When he doesn't take the Percocet, he feels like he's going to vomit and gets sweaty and covered with goosebumps. He can't go back to work because of the pain, so he loses his medical insurance and must apply for Mass Health, which will take 4 more months. He has to find alternative ways to control his pain and symptoms. He experiments depending on his budget, creativity, and courage. He finally gets an appointment with me, his new primary care doctor. After my first NPC with Mr. Custer, we schedule a follow-up to focus on his back pain. My new doc looks like a pushover. Don't see a problem getting more perks from him. You will not get a script without a clean urine, I promise you. And that clinic does observed urines. As I was saying, physicians assume opioid users are liars. Not because of their personality or anything, more like an occupational hazard of opioid use.
Making It to the Registers, a migrant healthcare worker's story. Storyboard and dialogue by Hugh Goldring, artwork by Nicole Marie Burton. Making It to the Registers, a migrant healthcare worker's story, is an open access publication based on research conducted for the project Making It to the Registers, documenting migrant carers' experience of registration and fitness to practice. This project has been co-funded by the United Kingdom Arts and Humanities Research Council, the University of Leeds Global Impact Acceleration Award Scheme, and the School of Law, University of Leeds Impact Fund. Back at the hospital. All right, Mr. Sutherland, it's time for your meds. Ms. Adebayo has been in hospital for a few days. She's presenting symptoms of chest infection, but is not improved with antibiotics. Yeah, she does not seem to be responding to the antibiotics. Have you considered TB? So let's try some other antibiotics.